The MASH students, this is Keith. He is the supervisor at NEA Baptist in Jonesboro. And so he came and he is going to help us perform a bronchoscopy on the pig lungs. So these are actual pig lungs. They're very, very similar to human lungs. They're the closest that we can get. These are preserved. They're actually a couple years old already. And so he has brought a brand new piece of equipment that NEA has, and it's a disposable bronchoscope. So what it is, it's a fiber optic light and camera at the end of that. And what we're able to do is go into the patient's lungs, and we're able to either perform diagnostic procedures or therapeutic procedures. So we might go in and like clean mucus out that's in the lungs, stuck in there. Okay. So my students know that's called a what when we do that? A mucus plug. But what are we doing with the bronchoscopy? We're going to go in and do a washing. He's trying to help you out. Okay. He's trying to do a washing. Or we can go in, so say we think that maybe the patient might have a lung cancer or a tumor inside their airway. And so the doctor will order a bronchoscopy, and we'll go in and we'll look at that area of the lung to be able to see, because there's no other way we can really go in there and see what the inside of the lung looks like without going in and doing like an open surgical procedure, right? So these are pig lungs. Right now we haven't used them in a while, so we have big areas that are collapsed. What's that called, guys? Big areas of alveolar collapse. Atelectasis, okay? Pretty soon I'm going to turn up the ventilator. This is what we use to ventilate patients in the ICU. There's several different kinds. This is what we have here. So patients who aren't able to breathe on their own, we'll put them on a vent like this, and that keeps them alive while we're fixing other problems. Okay. I want you to take a look at the lungs here real quick, and then what we're going to do is actually perform the bronchoscopy, and so you'll be able to see what the inside of the lungs look like. So you can see right here, y'all will remember from anatomy, you can see the trachea, right? We talked about that this morning when we talked about CPR. The trachea lies right on top of the esophagus, okay? So somebody who's trached or has the hole in their neck, right? We can do that because the trachea is next to the skin there. And then you can see the lung tissue. You can also see, I'm going to try and pull this apart. It's kind of stuck together. Okay, so you can see where the lungs split off. That's called the carina. Okay, so the right and the left. We've got to be able to ventilate both of those at the same time. But where it splits off, and you'll be able to see that once we actually put the bronchoscope in there. So you can see this, all this area is really, really smooth, and then this is getting very nice and big and full when it inflates, right? The reason that this is smooth is because it's all collapsed. And so I'm going to show you what it looks like. We're going to increase this just a little bit, give a little bit more volume. I promise I've done this, so it's not going to explode on us. Okay. And as we deliver a few breaths, and then I'll add a little bit more pressure, you'll see those start to pop open. And so we call that alveolar recruitment. So each one of those areas that's blown up, that's because there's teeny tiny microscopic air sacs in there. And as those air sacs start to expand, it expands the whole region of the lung. And so you can see down here, these are starting to open up.
Are you talking about the alveoli?
Mm-hmm. I sure am. So you can see how that's starting to open up. Every breath more and more opens. So I'll add a little bit more heat.
Is everybody trying to time their breaths with it? That's what I do.
Put them closer together too. You see how they're just starting to open. So what we'll do, we're just going to continue to do that as the pressure builds inside the lungs, which is a good thing in this case because we want them all to be open and working, right? As the pressure begins to build, we'll go ahead and do the bronchoscopy so you guys can see what the inside of the lungs look like. This is that tube that we were talking about, that endotracheal tube. So the one that goes from the outside of the body and goes straight into the trachea. That's what we ventilate with. And so we're able to use that bronchoscopy and take the camera all the way down that tube and actually down into the trachea. And so then you'll see where the carina is, where it splits into the right and the left, and then you'll also be able to see the different airways that go down into the lungs and show all the different lobes. Okay.